Thanks, Cesar, and thanks, Tamara, for hosting this webinar. I want to thank the Cuban Ministry of Health for participating tonight. It's difficult for them to connect live, and I know a lot of them are watching tonight in Havana. And a big thank you to Helen Yaffe for staying up with us this evening. It's now going on 2 a.m. in Glasgow, and for her support for the Pacemaker campaign. In early January, I called Helen to commiserate about how the blockade and the current economic crisis has been punishing Cuba's healthcare system. And we discussed for the first time the shortage of pacemakers in Cuba. Well, we came up with a game plan, and now here we are 5 months later, and I'm proud to report that our first donation of pacemakers arrived in Cuba just this week. The Pacemaker campaign is a unique effort. It's also an unprecedented undertaking. In my 30 years of providing solidarity and humanitarian medical assistance to Cuba, we've never attempted something so challenging and yet potentially so rewarding. In some ways, it reminds me of the imperative for the syringe campaign several years ago, insofar as it addresses a critical need with life and death implications. Now, for those of you who might not be familiar with the Saving Lives campaign or the syringe campaign, the Saving Lives Coalition, which is comprised of dozens of individuals and organizations that are working against the blockade, we came together during the first days of the pandemic. And the syringe campaign, which was initiated by Saving Lives, is likely the single most important humanitarian assistance program that we've ever collectively attempted to support Cuba. We delivered 6 million syringes at a time when syringes were almost impossible to source. If folks remember, every city, every state, every country was looking for the exact same syringe. Now, although Cuba had 2 COVID vaccines that are as effective as the Pfizer vaccine, the Moderna vaccines, they didn't have a sufficient number of syringes. So our efforts, we raised roughly $640,000. We saved countless lives in Cuba. We helped them to vaccinate their entire population, and we helped to reopen the country. Now, like the syringe campaign, we began the Pacemaker campaign with relatively modest goals. In this instance, we plan to raise $150,000 and to send 300 pacemakers to Cuba for patients with severe cardiac disease. And for the first time, we're coordinating this effort collaboratively with Europe, Global Health Partners, which is the organization I work with, and Cuba Europa, which is the leading European solidarity organization that provides medical assistance to Cuba. We've come together to lead this campaign, raising funds in the United States, Canada, and I think in 9 European countries. Now, Cuba has a 3-year backlog of patients that need pacemakers. And currently they have 80 patients hospitalized and tethered to external pacemakers. And as you might imagine, you don't last very long on a pacemaker waiting list. As you've heard, due to the sanctions in large part, Cuba's been unable to purchase pacemakers in the international market. Due to Cuba's inclusion on the terrorist list, manufacturers simply don't want to sell pacemakers to Cuba. And even when they do, Cuba's unable to access the global banking system in order to pay for them, as Helen outlined a little earlier. Now, there's also a tremendous consolidation within the cardiac pacemaker industry. A small number of companies dominate the market. 3 of the largest companies, Medtronic, Abbott, and Boston Scientific, are based in the United States. The other 2 are from China and Germany, and with the exception of the Chinese pacemakers, which I really can't speak to, all of them use US manufactured components, which means they require a license from the United States government in order to sell to Cuba. And none of them are willing to sell to Cuba. So Global Health Partners applied for a license permitting us to purchase and donate pacemakers to Cuba. And after months of discussion with pacemaker manufacturers, we have a leading cardiac company that's selling to us. We've already purchased, along with the Europeans, 130 pacemakers, and we have orders for 100 additional units. Now, there's an another important component to the Saving Lives campaign, and we're mentioning it here, and that is removing Cuba from the terrorist list. One of the most punishing acts of the Trump presidency, and there were many, was President Trump's designation of Cuba as a terrorist state. And it's the SSOT designation that prevents them from normal financial transactions. When we talk about Cuban migration, and more than 500,000 Cubans have left the country over the last 3 years due to the serious economic crisis. It's the SSOT designations that helping to fuel those hardships. And when we point to the tremendous difficulties that humanitarian organizations have providing Cuba with essential medicines, medical supplies, and even food, which are increasingly difficult to buy and ship in international markets, it's that terrorist designation that makes all of these efforts so challenging. You recall that candidate Biden promised to roll back the most egregious Trump Cuba policies 3 years ago. Well, today we're still waiting for President Biden to keep his word. Biden's current policy, which is sadly a continuation of President Trump's, is costing immeasurably hard pain, suffering, and even death. And removing Cuba from the terrorist list can be done by executive order. So there's a toolkit and links on the NNOC and Saving Lives websites where you can let the White House and the State Department know that you want Cuba removed from the SSOT list. And I'd urge everyone to click on those links when this webinar is over. I think they'll be posted by the organizers. I think I'm going to pause at this point, but I also want to ask everyone on this call to think long and hard about what they can do to help support this life-saving effort. It's rare when each of us have an opportunity to save somebody's life. And this is not one of these feel-good emotional appeals that you most likely find every day in your inbox. I've gotten dozens today alone. $500 will save someone's life. Let me repeat that. $500 will save somebody's life. So for those of you who've already contributed to this remarkable effort, you have my deepest thanks. If you haven't, I urge you to kind of step up tonight or in the next couple of days. Truth be told, everyone in the United States has access to pacemakers, should they ever need one. It's covered by insurance, including Medicare. Many of you on this call may have a family member, a friend that has a pacemaker. But to be told you need a pacemaker and that there's a 3-year waiting list, no patient, no family, no doctor should ever be in that position. So I'm asking everyone here to lend a hand and to contribute what you can to support this remarkable project. I was told a couple of minutes ago that 2 members of the Saving Lives campaign have contributed $1,000 each this evening. If anyone else can match those gifts, please let us know in the chat function or email me. Contributions are tax deductible, and you can make them online at ghpartners.org. Now, earlier, I told you that we had a modest goal of raising $150,000 and sending 300 pacemakers. Well, as of today, collectively with Europe, we've already raised $157,000, and we have pledges for at least 20,000 more. The first pacemakers arrived in Cuba on Tuesday this week, and we're discussing scaling this campaign and sending as many as 400 or 500 pacemakers. Cuba needs roughly 2,000 pacemakers to take care of all the patients on their waiting list. So please do what you can. No matter how much you give, you'll be helping to save a life. At the same time, you're standing up to oppose a blockade that's killing just as surely as bullets and bombs. So I'm going to stop there. Thanks so much for listening, and hopefully we can open this up to questions and answer.